So today I'm going to go over just because I'm Nicole Yates, by the way. I'm this owner and a speech therapist. So I've been doing this since 2007, so like a long time. And I've been in schools, hospitals, long-term care. I've been in lots of things, and I have two kids of my own, and they're both in different like private and micro and like special schools. So I've learned a lot through that, and also insurance, and then running a business of my own. I've also just had to learn a lot of things, and the just kids don't come with a manual, and there's just so much to know. And sometimes we just don't know where to go or what questions to ask. And there's so many resources out there that people just don't know about. And that's the great thing. Like, I hopefully at the end of this, you're going to learn something that's going to help you and your child. Um, because there's a lot. So if not now, even some of the information might help you in the future. So I put this as like, what do we do now? Because especially your kid starts to turn around 5 because you don't know what to do, or if your kid has needs therapy and you don't know where to go, or how to help them, then this is kind of um it goes about that. So I'll try to be fast because everybody has kids, and I have a cold, so I'm drinking tea, and will just be a brief overview. And I'm sorry if you hear my dogs barking. So here we are. All right. So the problem is a lot of the problem is like when you have a child with any kind of needs, speech, OT, or any kind of needs, we don't know. Like the doctor gives you a referral list, and you don't know where to go, and you're just like, here's a list. They either take your insurance, or they don't, and they don't give you a lot of direction. And how do we pay for it? Sometimes people come from the like everybody has an opinion. So whoever you talk to, like they'll give you all this information and you're not sure who to listen to. Or the other way where no one has tells you anything. You're kind of lost. So I find parents are kind of in the one, like they're not really sure where to go. So there's just a huge disconnect between what is out there and available for parents and children, and what and like and the knowledge. They just don't we just don't know. So that's what I'm trying to kind of help with these parent support groups. And I'll be having these once a month with more like tips and tricks and just things to help your kids and your families, because um, I do have experience, but also like I'm always trying to learn more and help. Like my goal with this business is to help families. So however I can do to support them. And these are just the questions that I get asked all the time. So I'm just going to briefly cover this because some people, and I, including me, didn't understand what insurance is. So a lot of people get their insurances through their companies, or there's Medicaid, Florida Healthy Kids, and insurance. So a lot of people think that if you work for a company, you have to use their insurance, and you don't. So as you know, Medicaid, like you have to qualify for, that's kind of a plan. And we're going to go over different Medicaid plans. But there's also something called Florida Healthy Kids. So some people, like if you start making, if you have Medicaid and you start making too much, people get nervous. But Florida Healthy Kids has plans from like $40 all the way to $250 a month, and based on income. And I know like many families who are business owners don't have, they're very wealthy, but they just don't have insurance for their company. So Florida Healthy Kids is a great option. It's up to $250 for those people who have the higher income. And it's just something to consider, because like insurance is really, really, really hard to deal with. And I'm not going to get into it too much, but for an example, just about commercial insurance, like I had a kid the other week, and I had to tell the parents that they had 30 visits covered last year, and the insurance paid $63. That's all they paid, because they had a deductible to meet. And then, so people think insurance is so great, but it's not always that great, because you have a deductible, and then it ends up being like, oh yeah, they did hit their 30, but then then that was it because you paid for it because of the deductible. So just FYI with insurance, like everybody thinks it's so great, but sometimes I think the Florida Healthy Kids is a really great option. It's basically paying for Medicaid. So here it's our Florida Kid Care is another name for it. So if you ever lose, like if you have Medicaid now and you lose it, know that Florida Kid Care is like, I think maybe lowest is $20 a month, but up to 250. Aetna Better Health is the ones for Florida Kid Care, Simply, Humana, and CMS. And then Florida Medicaid is Simply, Sunshine, Humana, United Healthcare, and Hillsborough, and CMS. And that's in Pasco and Pinellas in Hillsborough. They're different. In every county, there's different Medicaid plans. Um, there is not one that's really like better than the other. When it comes to therapy, I can only talk about like because I only know therapy, but there's things that people don't know about. If you have Florida Kid Cares or Florida Medicaid, they do things like all these plans pay for mileage. So if you have to get like a Medicaid driver, like they'll pay for that. If your child's in the hospital, they can pay for food. If your child has asthma, like there's things that not all plans do, but there's like they do your carpet cleaning. Like there's a lot to be included in these plans, and people don't know about it. Even like horse therapy and art therapy, like there's a lot included that people just don't know about. So like look into that. I know like gas is expensive, and if your therapy place is far away, you can get that mileage covered. There's ways to do it. So ask your plan. Children's medical services is what I recommend for most of my families because it's a protected plan from the government. You
Okay.
have to still qualify for it. Did you have a question?
Is the Children's Medical Service, Florida Kid Care, and Florida Healthy Kids, are those all separate or are all those like one thing?
So there you can like simply in both like in Florida Kid Care or Medicaid. So they're the same plans, but you just don't pay for it with Medicaid and you have to pay for it for Florida Kid Care. It's still based on
Oh,
a sliding scale. The
okay.
CMS though, you still have to qualify for it based on income. So like
Yeah,
you
right
can't
now.
get Florida Kid Care and not qualify for it.
Yeah,
It-
and I was real worried about when we don't have Medicaid anymore. So the Florida Kid Care.
It's a
Yeah.
great option that people don't know about. And I just think I know for me, I mean, to be honest, our kids were on Florida Kid Care for a while because it's a great plan. It was so great to go like get my daughter's adenoids out. And it was $5 a
Wow.
copay. I mean, everybody wants these commercial plans, but now a lot of like therapy clinics don't take Medicaid. We do. But for like major pediatricians, hospitals, that is usually covered. So some people have to know that they're going to pay out of pocket for like good service, like the higher services, but it's still for us was worth it. So I think it's just something that people don't know about. And
Yeah.
medical services, I put it on here, the different brackets, because you do have to qualify. And you can see what those are with the income and how many family sizes is it. And you can go on the website and it has the same thing. Um, but it is nice because you also get a case manager. And I think this is so helpful. And I've heard there's good case managers and not so great case managers. But especially when if you have a kid with special needs and you don't know what to do. Like some of our special needs kids need like diapers or something, like you can get that covered. If you have to get a special formula, like you can get those things covered. Um, like they're gonna help check on you once a month, and so just having someone to check on you once a month and be like, "Hey, what do you and your child need?" And like they need an ENT who's a network, they can help you find someone. So I love CMS, and it's like I said, it's very protected because it's for kids that have special needs, and you can switch at any time. So, like, if your
Oh,
child, that's what I was saying. Right now, it's operated by Sunshine Health. So there's CMS Sunshine and just Sunshine. But it's actually going to be in our area. I think it's going to Meriton in the fall. So CMS will be operated by not Sunshine, a different company, but it's still, like I said, a protected. There's just less issues. They're going to support you more and your kids. So if you can qualify for CMS, they'll ask you some questions about development. I think it's a great service. And again, people just don't know about it. Um, and as far as commercial insurance, just to kind of go over it for some of the families that do have insurance, like I said, the copays and co-insurances, it's just disappointing when I tell people, like, sometimes things aren't in real time. So if you have 30 visits a year, but you maybe have used some of them, or I don't know, the dates didn't match up, sometimes we'll call and they'll say they have 30 less, but they only have 20 because it's not the right system. And then parents get upset with us because they thought they didn't know they were going over and they would have stopped. And we understand that. But that just like this is why commercial insurance is so hard. It's such a benefit. Like it's great that people have it and they want to use it for therapy, but there is some struggles with it. Um, Diagnosis code sometimes develop like if you it's a developmental code, like they'll say they cover speech therapy, but because your child is being for developmental speech and language, they won't cover it. And sometimes we have to like ask the doctor for like a more accurate diagnosis. Some billing codes are more than others. So sometimes parents get upset and they'll be like, why was my bill $80 this week and $30 this week? Well, the therapist did something different and codes are different. So that's something that parents don't understand a lot. Um, and so I just thought I'd put that on there because it's confusing. Like when you go to the doctor's office, I don't know, when you get your bill, like it's based on different billing codes, and we do the same thing. But this is just another reason why insurance can be so confusing to families. And it's hard to take, but we're doing it because we're trying to help families. Also, I've had another family I just talked to who has like two United Healthcare plans. Well, it doesn't really matter. Like if one has copay, the other one has a deductible to make, so it didn't really help. And some people think more plans are better, and that's not always the case. So just really look into those things when you're getting insurance, especially using it for therapy. So I know we're talking about schools, but I want to cover this too because it still all goes together for our kids. Out of network, we bill out of network. So if you have Blue Cross Blue Shield is a big one. They do not let a lot of people in network. Every now and then someone has a tie and can get into network, but we've tried for like 15 years and we haven't been able to get in because there's too many people in network in the area, which is not true. But a lot of times for out of network, it's like a wait and see. Like we'll just bill it and we'll like sometimes they pay and sometimes don't. So again, we try, but it doesn't always work. Some families will submit like a super bill at the end of the sessions and then they get that fund. The insurance will pay them back. There's also something called gap insurance, and this is important for out of network people. So for like Blue Cross Blue Shield, there's an option. And like I said, I know just it's just information for everybody. There's an option where if we don't take Blue Cross Blue Shield, but we have a specialty feeding clinic or we have oral facial myofunctional therapy, and there is nobody in network in 30 miles, it doesn't have a 6 month wait list, you can call and ask for an out of network exception or like gap. Some insurances call it different, and then they will make a contract just for your patient, just for your child to get services there. It is a lot of work. So um, I can't do that every time, but if you want to put in the work to find all of that and do all the paperwork, I will sign and we will fill it out and we'll work with you. Um, but we just don't have time to do all of it, but we will do everything we can to help you guys get covered. But that is an option that people don't know about. If there's a long wait, you call and say, can I get an exception? Because I can't find another speech therapist who does prompt or whatever. They sometimes can do that. And people don't know about that. Okay.
Okay. Mm.
Um, Here's some scholarships that they have. They have therapy scholarships. You can just Google it. Step Up is the biggest one, which I have. That's basically the rest of the slides. So I'm going to talk about that because you can also use it for school. There's Small Steps for Speech. Elks Club has OT and PT in the area. That's pretty cool. Apraxia Kids gives out free iPads for kids with apraxia. So there's just a lot of things out there that people, if you're trying to get therapy covered, to look into. They're not, and it's not easy. It takes a lot of work, but some families, if you're trying to get this covered, it does work. So, but I'm a big fan of Florida Healthy Kids. I'll keep saying that because it's like affordable for everybody, and you can't qualify for Medicaid. And yeah, so
So glad to
um,
know.
yeah. So Step Up for Students is a scholarship. This is the big thing that kind of is amazing. Okay. They have different ones. They have a reading one, but I'm going to focus on just two. There's something called PEP and there's something called unique abilities. So pretty much if your child goes to Bayside, they probably qualify for unique abilities. I'll go over the scholarships. But that's anywhere from 10,000 to about $30,000 a year to pay for private school, homeschool, anything really. I mean, $10,000 is a lot of money, and people don't know this exists. You can also get this at starting at age 3 for unique abilities. So if your kid needs therapy, start at age 3 because I'll tell you, because even if you don't use it at age 3, you will use it by age 5 for your therapy or school. Because it's fun to get, like sometimes people will get the money when they're 3 and they're like, let's buy them the toys because you can buy a lot with the scholarship money. That's enrichment educationally, but then always just be mindful of what's going to happen. Um, PEP is for not unique abilities, but it's about $7,000 right now a family, so anybody can get that. And they just opened enrollment for 2026 and 2027 in February, so you can apply now. If your child, I'll go over that real fast. So this is are we eligible? As you see, these are the eligible diagnoses for unique abilities, speech impairment, language impairments on here. Um, I know some people like try to get like the autism or ADHD diagnosis. That's actually just FYI. Sometimes it's a harder diagnosis to get like qualified, and they tell you how what paperwork you need for those diagnoses. Whereas like speech and language is a pretty easy diagnosis. You just need to get a prescription from the doctor with a diagnosis, and then a report from us. So sometimes, like, yes, your child may have ADHD or autism, but you're going to get the same amount of funding. So just go with the easier diagnosis if it's because it takes forever to get those diagnoses. So, um, yeah, this is the funding. So, like, I just put on here like Pinellas and Pasco. So, grades K to 3, they got 10,324. This was for this year. And I don't want to go into this too much because it's a lot. And I just kind of want to give an overview, but maybe we'll have more talks on this. So you see the funding, how it goes up to 22 and like 36. Like there's a lot of funding there. That's based on their IEP levels. So if you want a higher level of funding, you have to qualify through it's called a matrix, and you will have to go to the school system for an IEP. And this is from what I know, and I could be wrong, so people correct me. I think there is a way to do it. Like if you're homeschooled and you go in, I'm just, and it's like risky, and there's just a lot of rumors out there. But like the 10,000 you're guaranteed on, if your child's like hospital homebound, you're going to get more of that higher funding. If they have really significant disabilities, you can get the higher funding. So there is ways to go about that, but for most people, like the 10,000 is what you're going to get. But
Yeah, that's
it's still,
normal. It's still a good amount for a kindergartner.
yeah. Now you can't. So here was the step up that can't be public school. So you cannot get this money and go to public school or charter schools. But
Private.
yeah, private or homeschool. So
Okay, private.
um there's a lot of different school options. Okay, this homeschool thing. So not only is Step Up coming out, with unique abilities and PEP, but they just had an announcement that there's going to be more funding from the federal government. So I don't know how much that is, but they're getting out more funding for private and homeschool kids. Know what this
Oh,
says about how they
yeah.
feel about public school right now, but it's not looking good, to be honest. And that's my opinion, not political. It's just like they're giving out so much funding, which is, I think it could be good or looked at different ways. But um, so they have something called micro schools. Like my son, he's in a micro school. So they are a nature-based school in Newport Richey where they do hands-on learning, and he does
Wow,
great there. Yes.
that's amazing.
And
Like
there's
feel like, and I don't want them in the private. If I'm being honest.
Yes, I know. And there's so much. And like literally every day, there's a new great homeschool. Now, there's something called co-ops too in homeschools. So if you didn't want to take them to a public school or a private school, but wanted to like take them to a co-op, like sometimes they meet 2 to 3 times a week and they'd have a teacher there and they can train her and teach you how to do homeschooling. So there's so much out there. So the micro schools are actually considered a homeschool. Your kid would
Wow.
be a registered homeschool. So it's your
Okay.
responsibility to educate them, and then you have yearly report, like yearly things. But
That's
it's
what
just,
I always said I couldn't do homeschool because I didn't think I could take on that with education. Maybe the early years I could, but I could not um after that.
well, this
Like
gives you the options because there's other things out there. Because not
yeah,
everybody's meant to be a teacher in homeschool.
what to do and like how to do it and what to teach, then
I
it'd be a
mean,
lot
and
more
like you
easier.
can there's the homeschool hive. If you want to Google homeschool hive, they have lots of research on all the different micro schools and co-ops and stuff. So if you want to go there, it's a school, it's a store, sorry, it's a store, and they can help guide you with what would be good for your kiddo. But you're looking at for it's just options, like it's educate it's just an option for you and your family, what you guys feel best with. Everybody's different, so it's just providing more options. um like the co-ops what's near you. So that's a homeschool hive is a good one. And on Facebook, there's a Tampa Bay homeschool community. So it's not just for homeschools, it's also for those micro schools. So that's an option. Those, I mean, I think they're good, but I think they are going to have to be regulated a lot sometimes, maybe eventually, because we don't know. Like, I love my sons, but other ones popping up, I don't know if they have teachers or they're licensed, but that is interesting too. Private schools, there's a lot of those, and they are more like have to give testing, and there's more to that usually. But one thing that people don't know about private schools, excuse me, you don't have to have licensed teachers. There's a lot of not very good private schools out there that are hiring people that are not really qualified. So,
Yeah,
I mean, there's
that's
some
scary.
great people. I don't know. I know it's very interesting. Like, they don't tell you this, but like, you'll go to these private schools and then they won't have licensed teachers teaching your kid. And it's just, I don't know. I just don't love that. But everybody's different. And I know there's some private schools without licensed teachers who are great schools. Um, but it's just something that isn't really talked about. So,
Yeah,
definitely reach out, ask families there, ask people that left, get a good opinion. But if you're going to go to the private school route, it's really important just to know that every child's different. So
yeah,
what works for one kid might not work for another. What works for one family might not work for another family.
yes,
And so,
definitely.
what works for you guys, and you might have to check it out. So I always listen to the good and bad, but really what's best for you and your kids and your family. So
Yeah,
yeah, it's
how,
important.
you know, they locked in all day. That's what I really truly want. And yeah, having somewhere he could go and still learn, but not be, at a desk all day would be.
Exactly. And you're not alone in feeling that way. A lot of families are feeling like desks don't work for kids, for every kid. Sitting in a desk in a four-room thing, it's walls, more walls. It's not every kid's cup of tea. And I think that's okay. And some
I could
families want that and some don't. And that's why it's
extra
just
work.
great. There's options. And then we have charter schools, which, again, no expert. I'm just going to tell you what I know. But they're public schools. So you would like the IEPs, but they don't have to take you as much as like a public school would. There's lotteries. So there's the good ones. I know like Dayspring in Pasco County has like 7 locations now, and there's like a lottery to get in a wait list. So if you want
Does
to
that
go to charter school, you have
we
to sign
apply
up early. For
to the
Daysprings?
lottery session? Yeah, their information session. Yeah,
Oh,
they seem good.
good.
We're on
Yeah.
the wait there, so not
Yeah. Yeah, there's a lot. Like I said, go visit, ask parents, ask if you're. I don't know anything about your kid, or you don't have to tell me, but like if your kid's struggling with sitting at a desk all day, like ask if this would be a good fit for your kid. Because if it's not, you don't want to send them up to fail.
yeah.
And I Day Springs is a great school, but I do know it's very hard on homework and high
About it,
tests.
about the desk like situation, like if kids having trouble like sitting still in his desk, and they're like, well, it's really important that they're able to sit still at the desk.
So if they're
uh,
telling you that, listen, because
mhm.
if he's gonna struggle, I think it's they're telling you don't want to start somewhere and it be a failure. Um, but yeah, like I said, everybody's different. I don't judge what anybody wants to do. It's just I think it's everybody needs to know about the options.
In that desk for him. Like, he could do good.
For what? What'd you say?
A walking like treadmill, under the desk.
Yeah, and maybe find a school that'd be open to something like that. There's so many out there. Like I said, even if you put in those Facebook groups, they do help sometimes. So if you're in like the Tampa Bay homeschool is a good resource for like micro schools and stuff, but um just asking opinions about things. There's also like a new nature one that's a charter school in Land O'Lakes, and I heard they're building a second location near Trinity area. So I can't think of the name of that, but they're popping up like crazy. like these
Yeah,
private schools, because
homeschooled down at Robert Key's beach right here in Newport Richie once.
there's so many options, which is cool, I think. But
Yeah, because I didn't know about, I mean, guess I did know about like homeschool groups, like going out and stuff. I guess I just didn't even know, where to look. But now I
and
do
that's
know.
that's I think the homeschool hive. I think it's in Carrollwood area. That would be a great store to go to and just talk to them and see if it feels like it's a good place. Like just they'll help
Right,
direct you to the right kind of places. And I mean, I know that several families try in one place and then they have to switch. That's okay. It's not the end of the world. But just know that if you're going to get the scholarship and you start at a charter or a public school, you will lose that money. So
right.
it's good. You can always apply for the scholarship and then not accept the funds when they get there if you're going to go to public. So you know that you have the scholarship for next year. But um, yeah, yeah, it's always good to have it and then not use the need it and not have it.
Yeah. I'll look at all the scholarships and probably sign up for whatever I can. I know the lottery like dates are ending really soon too.
Yeah,
And
I
I'm pretty
know.
sure I signed up for all the charter in my area. um,
Yeah,
but I
and
just not.
after we're done, I'll talk to you a little bit about what I think is maybe where you've got it, but and maybe I can give you some ideas. But I'll also just FYI, so the scholarship, like I said, it pays for homeschool materials. It can pay. This is where I kind of want to give a warning out if you do get the scholarship, and we take step up for students. We take that scholarship, but let's say you have to go to a homeschool program and it's $8,000 a year. That $2,000 can go very fast for therapy. Just be really mindful when you get that money, because it sounds so great. People are like we're separate providers, but my son's like co-op. Micro school takes all of his funding. I don't have any extra to pay for all these extra things. So a lot of like people will pay. Like you can pay for like the internet for a homeschool. Like it will help pay for your internet if you're homeschooling, which is great. But it's just I know a lot of people like when they first get it, like I said, especially when they're three, like get a playground or all these things, and then you don't think, oh, when they're five, I want to send them to school that's $12,000 a year, and I could have saved that money up to pay for the extra funds. So
Yeah.
I always just am like, hey, when you get the money, there's a lot on there's like a shop you can look at for things for your kids and if they're sensory seekers. There's a lot of great things, and it's great to use them, but just be mindful because it's a mistake that many families make, and I think providers too aren't always thinking for families that take the scholarship that like don't take Medicaid or don't take insurance because they're thinking, oh, well, I take the scholarship, just use it on me. But oh, also your child's gonna need other things. So maybe don't use it all on me, you know? So I just think
Mm,
it's good to be mindful of that. And it's a mistake that a lot of people make. And they're not probably thinking about it either. It's just so you know. But yeah, that is all. So any general questions, and then I'll stop recording.
mm. That's the only thing. If the person that decides he needs an IEP would be his doctor.
No,
And
so
then,
the IEP comes from the public school.
okay, public school is IEP, so that won't help him in charter really.
They'll or charters will do IEPs as well.
Oh
Yes,
yeah,
so
those are considered kind of, I mean,
public, but they don't
okay,
have. If your child has an IEP, they might say it's not a good school for your. The charter school might say it's not a good school for them.
the
Um,
school thing, or
say
I
it again.
ask they initiate the IEP, the school, or I ask them like he might need one. Like I don't know who to talk to. Like, does he need one? I don't know.
Yeah. So a few things. If your child's going to go to public school, IEPs are great. I didn't really talk a lot about public school, which I can probably do in the future. Public schools do have some great options sometimes. Like they're also good options. They have you can have an IEP and like speech therapy and OT and PT, and there's where charter schools or private schools might not have those options. So it's not always, like I said, it's not always a bad option, public school. Um, if you find a good one and your child does well there. But so if you have a speech, if your child's going to kindergarten, if you have a speech or an OT evaluation, go ahead and bring that at registration and they can probably start the play IEP immediately so they can get services right away. If it's an ADHD diagnosis, you can get something called a 504 plan, which is different than the IEP, which still gives accommodations. So you can get that soon too. But yeah, I would just say at registration, my kid gets this therapy. How can I make sure that he gets started as soon as possible with a plan so that he can be best supported right away?
Okay.
So that's how you would get that. But that's a good question. And it's something to mention that public schools, I've been promoting because step up, people know about public schools, but they don't know a lot about private and micro and all that kind of stuff. But also public schools, like um I was talking to a friend who owns Because You Can in St. Pete. And they have a contract down there with a lot of schools in Pinellas where they'll send like an ABA instructor one on one with the kids. So a lot of families that have like nonverbal kids, it's in a public school, get a aid. Like so that way a lot of parents are afraid to send their kids to school if they can't talk yet because they can't tell them what happened. But if you know you have an ABA with your kid, a behavioral therapist with your child all day, you're more likely to send them. So there's like I said, there's so many creative ways to do things.
Yeah, I'm glad. I'm so glad that we
Yeah,
could,
okay.
all potentially.
Yes, I'm gonna stop recording. Okay, stop